Thanks. It's nice to be here. I am a difficult person. When I was little, they called me Mr. No. Anything that they said to me, I would say no. This has kind of continued. And so when someone tells me to do something, I say no. Like that's my reflex is no, I don't want to do it. If it's something I want to do, then I just do it. But if you tell me to do it, then I will no longer want to do that thing. The reason I share that is I think that everyone is like that. I think there are things that we may know are interesting, but if we're told that we need to do it, then we don't do it. I share that because I think that the approach that has been taken historically in terms of trying to establish scientific principle, I think it's changed, and it's changed for the worse. I think we now try to prove why we're right and why other people should do things. Everybody should do X, like whatever it is that we say. And we forget that people have agency. And when you can invite somebody to consider an idea, when you introduce a question that's interesting to them, they engage with that question in a very different way than if you were to tell them, this is now what we need to do. I think there's something of an obsession with expertise and guidelines. We think that the guidelines need to say something, and if they do say something, then we have to do it. When it comes to healthcare, I think this is a problem. Because every patient we see is going to present us with an opportunity to step outside of the guidelines. And we always must step outside of the guidelines when it's required by the patient. Right, so we aren't algorithm-driven entities. And the more that we function as algorithm-driven entities, the more replaceable we will be, even today, right? So the work that's being done recently, and with growing numbers of papers, it's very exciting because what it's doing is it's allowing for us to see a path, right? And we're starting to get a sense of what that path is, and it's defined by the accumulating experience of people in the field. Right? If you consider like what a path is, like the idea of a path invites participation, right? We get a sense that this path is worn by many feet walking it. So when we look at the accumulating papers and the data, what it's telling us is this is the experience of a growing number of people. And what we want to do, rather than telling people you need to walk this way, we want to invite people to consider what's on the horizon and how will they get there. I don't know if you've ever seen this in terms of the way that they lay out college campuses. They'll put the buildings down, and then they'll put the sidewalks down, and invariably, there's a path worn in the grass between the two, like the easiest ways to get between buildings, right? The right way to actually lay out the paths is to wait, just build the buildings, and then see where people walk, and then you pave where they walk, right? So this idea of how do we actually shift our perspective? We aren't in a position to say everybody should do this. What we want to do is we want to trust in the capacity of every practitioner to contribute to this field. We want to hear from them. What are you seeing? How are you approaching this work? What do you see as opportunities? And then to be able to capture that experience in a collective way. So to be able to do that, it's really challenging when you're trying to kind of advance a new field. Because there's momentum, there's inertia, and we really feel like if we can make a change at the top, everything will get better. But I don't know that that's ever really played out. So I think what we need to do is, as we're talking to these organizations, as we're talking to people that develop guidelines, what we want to think about is how are we inviting participation and contributions from people at the grassroots taking care of patients, and how are we helping them share their stories and hear insights from other stories. this is the mechanism by which cystic fibrosis was cured. Right? It was a very different model. It was a model of support, encouragement, collaboration, allowing for the flow of resources and information between the grassroots and a learning entity. And the reason they were able to do it is because the people that were running that foundation that did that learning were the parents of the children with cystic fibrosis. Right? They had no aim except to serve their children. I think what is in front of us is the opportunity to create an entity or collaborations across entities that maintain that same moral authority. All we care about are kids breathing better, right? When that's the only marker, then that's the only measure by which we judge our success, we'll see things move more quickly forward. I wanted to just share in its simplest form, and this is based on, so I have about more than 47 years experience with sleep and breathing. That's how old I am, Milt. That's what I mean. So all of us have experience with sleep and breathing. All of us have experience with talking with people. I have about 20 years experience in medicine, 15 years of experience in sleep and breathing, in diagnosis of sleep and breathing disorders. When we look at this, there's a couple of things that are clear, right? Sleep disordered breathing is bad. It's bad for you, right? Everybody knows this. This is clear. The position and tone of the tongue are central to treatment of sleep and breathing disorders. Right? We all know this. This is very straightforward. Every treatment of obstructive sleep apnea has something to do with the position and tone of the tongue. CPAP just moves the tongue out of the way. Right? Adenotonsillectomy allows for the airway to be bigger, so that the positioning of the tongue is different in relation to the rest of the airway. When you look at Inspire, like the genoglossal stimulators, Inspire just changes the tone of the tongue. I was sitting with the representatives of the Inspire company, who are seeing great success with this treatment, and I had a chance to ask them. I said, so we know that changing the tone of the tongue will change the airway. So what are other ways that we can change the tone of the tongue? And I said, what do you mean? I said, is it possible? Like, have you ever tested actually the tone of the tongue after years on Inspire? Have you ever taken them off and seen if they get better? I mean, why would they do that? Of course. So, and they were very open to the conversation. They said, that's really interesting. We've never thought about that, right? But this idea of how are we actually bringing people that are asking these questions together, that have confidence in the approach, to say, okay, what possible questions could we follow together that would be interesting? So, what I'm trying to get to, and I think what the title of the talk was, is just simple collaboration. When we get into the details, and it's exciting to look at like the speakers that are coming. We're going to get a lot of a deep dive into the pathophysiology and the opportunities in terms of treatment. But when we pull up to the conceptual level, we see that actually the work in front of us is very simple. We just need to follow more cases with children and to see how is it that we can work together across disciplines to change the position and the tone of the tongue. So it's exciting to be here. Thank you so much for this time. It's an exciting panel, and thank you for the opportunity.